Hi everybody, my name is Dr. Pat Progar. I'm the Chief Clinical Officer here at Brett DiNovi Associates.
And I'm Dr. Frances Parn. I am the Executive Clinical Director here at Brett DiNovi Associates.
And we're coming to you from our headquarters in Mount Laurel, New Jersey. We're going to talk about, I think, a pretty interesting topic, some kind of a myth or something you've heard about ABA. And we'd like to remind you that if you like what you're viewing, please like and subscribe and help us disseminate the science of behavior analysis. Myth number one, and again, we've talked about this, we've kind of kicked around some different ideas. There are obviously going to be other ones out there, but we thought these are kind of like the top 5 or so. So myth number one is that ABA is only for children with autism. So we hear this a lot. And if you're watching this, hopefully you know that ABA is widely known for its effectiveness in supporting individuals with autism. That's where we know about that. But it can be applied to a variety of populations and behaviors. ABA principles are used in things like education, workplace efficiency, health and fitness, addiction treatment, and developmental delays. One of the things, if you think that the field is only for autism, you should know that there are a vast number of careers that you could choose from.
Myth number 2, ABA is rigid and robotic. I do think that this is a perception that has been around for a long time. But really what we know is that ABA is a highly individualized and flexible science, right? It is a science. We have these principles of behavior. We use them to tailor interventions to each person's unique needs, their preferences, their goals. And I think that if you dropped into a lot of ABA programs, whether it's a classroom setting, early intervention setting, or social skills group, that you would find it anything but rigid and robotic. We really try to put meaningful learning in the natural environment so that individuals are learning new skills in their day-to-day activities. So not robotic, not scripted. The goal is to have people function better in their environments.
And I would agree entirely. And one of the points that I actually absolutely love that you said is actually observe a session, right? And if you observe a good ABA session, you'll know that this is a complete myth. And I'll give you a quick example. This is a couple of years ago. I was at one of our social skills events. It's held at our Operant Learning Center. And the BC who's running it literally put her heart and soul into this event. And she had the kids laughing, she had the staff laughing, they were engaged, getting a lot of behavior out of the kids. And after everybody left, I hung around for a little bit and she said, what do you think? And I said, I just have one question, it's a little personal. And she's like, yeah, what is it? I said, did you major in drama or theater in college? And she kind of started laughing. She's like, actually, I did. And I said, I can tell, because I said, you really put everything into it. And when you look at the advances those kids made over time, clearly part of that was just how reinforcing and how spontaneous she was and the rest of the staff. I mean, it's really remarkable. So if people ever hear this type of criticism, it's completely false. Number 3, I'm sure people have heard this one, myth number 3, ABA uses punishment to change behavior. All right, it's the, and I mean, I've heard this from other professionals in other fields, like, oh, you're the shock and M&M people. All right, that either, I'll give you M&Ms if you're good, but if you don't, I'm going to shock you. All right, and that clearly is false. I would argue that that's almost always been false. I mean, clearly we have used punishment in the past as a discipline, but disciplines evolve over time. There are techniques that medicine has used 50, 100 years ago that we might look at and be like, how did they, or why did they even do that? Well, that was a state of the art at the time, right? So one of the things we try to do is focus on a lot of positive reinforcement. It doesn't mean that punishment is never used. If you do have to use it, it should be in an ethical, carefully monitored way. And again, a quick example. I mean, we both have kids. I've used timeout, right? Timeout is a punishment procedure. I think it's pretty innocuous, but I do think it's helpful sometimes for that person to come into contact with those contingencies, kind of like I went a little bit too far, and that's not appropriate, right?
If it is an intervention that we're going to resort to, similar to timeout, probably you're going to look at something like what we call response cost, which is loss of privileges. I might take a token away because you engaged in a problematic behavior versus the appropriate behaviors that you use to get those tokens. Myth number 4, ABA is all about compliance. No, we don't. Our goal is not to have, again, little robots walking around doing everything that we ask them to do. Our goal is about providing reinforcement for behaviors that are going to gain that individual independence. So teaching functional skills and perhaps providing some reinforcers along the way to motivate the individual to do the things that is going to increase their quality of life over time. So our goal is to increase skills.
Yeah, and there's actually, as I think about this, there's some interesting work that Ray Miltenberger had done. For example, I think he was up in North Dakota at the time, but it was sort of alerting others to the presence of like a stranger trying to accost you, right? So he's working with kids with, I think it was autism, but clearly there he's, in a sense, he's teaching not compliance, right? Somebody says, come with me, or I want to show you my puppy. He's actually trying to teach them like, no, I'm not going with you.
Right.
You know, so yeah, again, another classic myth that we have there. Number 5, ABA therapy is the same for everybody. And again, we've sort of talked a little bit about this, but again, ABA therapy is completely individualized. We conduct a variety of assessments, understand each person's strengths and weaknesses, and we create personalized intervention plans. I've been doing this for a long time, and there are no two individuals that I ever said they're the same, right? They come to us with unique histories, unique family situations, unique options after we're done working with them, and you have to kind of take all that into account.
Yeah, different preferences. Everybody likes different things that end up functioning as reinforcers for them, and so we individualize their plans to make sure that they're able to access those types of things. This is perhaps not a myth, but maybe more of a misunderstanding. Add one more in, that when you tell someone, what do you do for a living? And you're like, I'm a behavior analyst. And their response back immediately is usually, you're analyzing my behavior right now, aren't you? You're analyzing my behavior right now, aren't you? I don't even know where to go from there. Not really. That's a lot of effort, right? Our assessments and interventions that really, are about the analyzing piece take time and take effort. And so we're not doing that in every social situation that we're in. It's a very structured and intentional process. It's not really sitting, in a family gathering or maybe a work meeting and, looking at someone across the room and analyzing their behavior in that moment. So it's not, something you do casually. There's a lot of intention behind it.
Yeah, I'd say, vast amount of the time when we're in a social setting or at home or whatever, we're off the clock. All right, last thing we're trying to do is analyze anybody's behavior. But I will give you one example where I did do this, and folks are over, a couple siblings were fighting, nothing major, no blood drawn or anything, but there was some screaming and yelling and, tussling on the floor and everything. And the one parent would start intervening, and she was doing the countdown, like when I'm going to count to 3, and if you're not done by 3, I'm going to, something bad's going to happen. And, it was like 3, 2, I really mean it, I'm going to count to 1 soon. And so that was going on, and then she was doing spending a lot of time trying to figure out who started it, all right? And kind of the general rule of thumb I've always followed, it's kind of like a hockey fight sometimes. It's like, you can't always figure out who started it, like both of them go to the penalty box, right? So at one point later that night, I think I was just sort of sitting there kind of observing all this, and she looked at me and she said, I'm really the problem, aren't I? It's not my kids. And I said, well, you're giving a little bit of attention to the problem behavior, and so we could work on that. But for the most part, we really don't do that.
Yeah, maybe in those rare occasions where it's just sort of thrust and anybody in the room could probably have picked that.
Absolutely.
So we hoped you liked this video on the myths and possible misunderstandings of applied behavior analysis. If you did, make sure you hit that like button and that you've subscribed to our channel.